Cancer, the silent killer, is weaving its way into modern life. It does not discriminate by age, often shows no warning signs, and can quietly grow inside the body for years before being detected. According to the International Agency for Research on Cancer, IARC, over 19 million new cancer cases were recorded globally in 2020, with nearly 10 million deaths. Even more alarming, this number is projected to rise beyond 28 million cases per year by 2040. At the same time, another silent crisis is spreading: obesity. Excess fat doesn't just raise the risk of heart disease or diabetes, it also creates the perfect conditions for cancer to thrive, through mechanisms like chronic inflammation, hormonal imbalances, and suppressed immunity. Modern research has made it clear, visceral fat and cancer are more closely connected than we once believed. But in the midst of this storm of cancer and metabolic diseases, the human body is not powerless. Hidden within the everyday foods we consume, nature has provided silent weapons, key vitamins with the power to fight cancer, burn fat, and activate the body's natural healing systems. Studies from top institutions like Harvard, Tokyo University, and Heidelberg have revealed that certain vitamins can inhibit tumor angiogenesis, the growth of blood vessels feeding cancer, activate immune cells, protect DNA from oxidative damage, and accelerate fat metabolism. This is not wishful thinking, it's science. Now is the time to understand these powerful nutrients, the vitamins that may serve as a natural shield against cancer and metabolic disorders. Let's explore them, one by one. 1. Vitamin E. Vitamin E is one of the most vital antioxidants in the micronutrient arsenal, offering powerful protection not just at the cellular level, but also in the broader fight against cancer, immune dysfunction, and metabolic disorders. Its role goes far beyond shielding cells from oxidative damage. It plays a critical part in strengthening immunity and supporting fat metabolism. While supplements can be a helpful tool, it's important to understand their purpose. They are meant to complement, not replace, a nutrient-rich diet. Vitamin E, especially in its most potent form, alpha-tocopherol, is a fat-soluble compound found abundantly in both whole foods and high-quality supplements. This makes it widely accessible for those aiming to optimize their health through both natural sources and targeted nutritional support. One key way vitamin E helps in killing cancer cells is by protecting cells from oxidative stress, which can lead to cancerous changes. Oxidative stress occurs when there is an imbalance between free radicals and antioxidants in the body. Free radicals can damage DNA, leading to mutations that cause cancer. Vitamin E neutralizes these free radicals, preventing them from causing harm. A study published in the Journal of the National Cancer Institute found that higher levels of vitamin E were associated with a lower risk of prostate cancer. The researchers concluded that vitamin E's antioxidant properties played a crucial role in reducing the risk of cancer development. In addition to its antioxidant effects, vitamin E can also enhance the body's immune response. Vitamin E supports the function of immune cells, which are essential for identifying and destroying cancer cells. A study in the American Journal of Clinical Nutrition showed that vitamin E supplementation improved immune function in elderly participants, increasing the activity of T cells, which are vital for immune defense. This enhanced immune response helps the body fight off cancer more effectively. Vitamin E also plays a significant role in fat metabolism. It helps regulate the body's use of fat for energy, promoting fat burning and reducing fat storage. A study published in the Journal of Lipid Research found that vitamin E deficiency impaired the body's ability to use fat for energy, leading to increased fat storage. Conversely, adequate levels of vitamin E were shown to enhance fat oxidation, the process by which the body breaks down fat for energy. This makes vitamin E essential for maintaining a healthy weight and preventing obesity-related diseases. Furthermore, vitamin E's anti-inflammatory properties contribute to its ability to fight cancer and support weight loss. Chronic inflammation is a common factor linking cancer and obesity. By reducing inflammation, vitamin E helps lower the risk of these conditions. A study published in Cancer Prevention Research found that vitamin E supplementation reduced markers of inflammation in overweight and obese individuals. This reduction in inflammation can help prevent the development of cancer and support metabolic health. Vitamin E is abundant in various foods, making it easy to include in a balanced diet. Nuts and seeds such as almonds, sunflower seeds, and hazelnuts are excellent sources of vitamin E. Green leafy vegetables like spinach and broccoli also contain significant amounts of this essential nutrient. Additionally, vegetable oils such as sunflower oil, safflower oil, and wheat germ oil are rich in vitamin E. Other sources include avocados, red bell peppers, and fortified cereals. Including these foods in your diet can help ensure you get enough vitamin E to support your health. Vitamin E supplements are widely available and can be found in most pharmacies, health food stores, and online retailers. Choosing a high-quality vitamin E supplement, preferably in the form of natural alpha-tocopherol, as it is more effective and better absorbed by the body compared to synthetic forms. The recommended daily intake of vitamin E for most adults is about 15 milligrams, 22.4 international units IU. It's essential not to exceed the upper limit of 1,000 milligrams, 1,500 IU, per day to avoid potential toxicity. However, it is always best to consult with a healthcare provider to determine the appropriate dosage for your specific needs. 2. Vitamin A. Supplementation wasn't developed to be an online internet scam. Supplementation was a really serious effort to improve global nutrition. Vitamin A is a crucial nutrient that helps maintain vision and boost the immune system. Recent scientific research also reveals that vitamin A may help kill cancer cells and burn fat, making it important for overall health. This vitamin comes in two forms: retinol, found in animal products, and beta-carotene, found in plants. Vitamin A helps kill cancer cells by controlling how cells grow and die. Retinoids, which are made from vitamin A, can cause cancer cells to die through a process called apoptosis. This prevents tumors from growing. A study published in Cancer Research showed that retinoic acid, a type of vitamin A, stopped the growth of breast cancer cells by making them die off. This shows that vitamin A can be a powerful tool in fighting cancer. Vitamin A also strengthens the immune system, helping it to find and destroy cancer cells. According to a study from the Journal of Nutritional Biochemistry, vitamin A is essential for the production and function of immune cells such as T cells and natural killer cells. The researchers found that adequate levels of vitamin A significantly improved immune response and slowed tumor growth in mice. This supports the importance of maintaining sufficient vitamin A intake for cancer prevention. In addition to fighting cancer, vitamin A helps regulate fat metabolism. It controls genes that are involved in how the body stores and burns fat. A study published in Molecular Aspects of Medicine demonstrated that retinoids activate genes that break down fats and deactivate those that store fat. This helps maintain a healthy weight and prevent obesity. Vitamin A also affects fat cells directly. Research in the Journal of Clinical Investigation found that retinoic acid reduced fat cell size and increased fat breakdown and energy expenditure in mice, effectively preventing obesity. These findings suggest that vitamin A plays a significant role in managing weight and improving metabolic health. Another benefit of vitamin A is its ability to reduce inflammation. Chronic inflammation is linked to both cancer and obesity, and by reducing it, vitamin A helps lower these risks. A clinical trial published in Nutrients found that vitamin A supplementation reduced markers of inflammation in obese individuals, supporting its role in weight loss and better health. The cumulative research highlights the multiple benefits of vitamin A in cancer suppression and fat metabolism. To obtain sufficient vitamin A, experts recommend including foods like liver, carrots, sweet potatoes, and leafy green vegetables in the diet. These sources provide both retinol and beta-carotene, ensuring adequate intake of the nutrient. By consuming these foods regularly, individuals can support their immune function, cellular health, and metabolic balance, making vitamin A a vital part of disease prevention and overall wellness. The recommended daily amount of vitamin A can vary depending on age, gender, and general health status. For most adults, the suggested intake is between 700 to 900 micrograms mcg of retinol activity equivalents, RAE. However, it's important not to exceed the upper limit of 3,000 micrograms RAE per day to avoid potential toxicity. 3. Vitamin D. Did you know that if you take an ordinary white button mushroom and slice it thinly, then leave it under direct sunlight, such as on a windowsill, the exposure to UV rays significantly increases its vitamin D content? This fascinating natural process shows just how accessible vitamin D can be from both diet and environment. Often referred to as the sunshine vitamin, vitamin D plays a critical role not only in bone health, but also in cancer prevention, immune defense, and fat metabolism. Vitamin D is unique in that our bodies can synthesize it when exposed to sunlight. However, it is also found in certain foods and is widely available as a supplement. One of the primary ways vitamin D supports the body is by regulating cell growth and promoting apoptosis, the process of programmed cell death, which is essential for preventing cancer. A study published in Anti-Cancer Research demonstrated that higher serum levels of vitamin D were linked to significantly lower risks of developing several cancers, including breast, prostate, and colon cancers. The findings emphasized the vitamin's protective role in suppressing abnormal cell proliferation. Vitamin D also plays a key role in enhancing immune surveillance. It stimulates the production of immune cells, such as macrophages and cytotoxic T cells, which are capable of detecting and destroying malignant cells. According to a study in the Journal of Clinical Oncology, cancer patients with sufficient vitamin D levels had improved survival outcomes and responded more favorably to treatment compared to those with deficiencies. This suggests that maintaining optimal vitamin D levels not only helps in cancer prevention but may also improve prognosis during therapy. In the realm of metabolism, vitamin D supports insulin sensitivity and blood glucose control, two crucial factors in preventing fat accumulation. Research published in the American Journal of Clinical Nutrition found that individuals with higher vitamin D levels were at a reduced risk of developing type 2 diabetes, a condition frequently associated with obesity. Moreover, vitamin D has a direct impact on fat cells. A study in the International Journal of Obesity showed that vitamin D supplementation significantly reduced body fat in overweight individuals by shrinking adipocytes and inhibiting the formation of new fat cells. Chronic inflammation is a shared underlying factor in both cancer and obesity. Vitamin D's anti-inflammatory properties contribute to lowering systemic inflammation, thereby reducing disease risk. A study in endocrine, metabolic, and immune disorders, drug targets reported that supplementing with vitamin D decreased inflammatory markers in overweight participants, supporting its role in improving metabolic health and aiding weight loss. To maintain adequate vitamin D levels, it is recommended to consume foods naturally rich in this nutrient. Fatty fish such as salmon, mackerel, and sardines are among the best sources. Egg yolks and fortified foods, including milk, cereals, and orange juice, also provide considerable amounts. Mushrooms exposed to sunlight or UV light are a valuable plant-based source of vitamin D2. For individuals with limited sun exposure or low dietary intake, supplementation is a practical option. Vitamin D3 is the preferred form due to its superior ability to raise and maintain blood levels compared to D2. Reputable supplements verified by third-party testing are advised to ensure potency and purity. While the recommended intake varies, many health authorities suggest a daily dose of 600 to 2,000 international units, IU, depending on individual needs and blood levels. 4. Vitamin C. If you want to top off your vitamin C, pure vitamin C supplements can provide a potent dose. Strong antioxidants like vitamin C are widely recognized for their ability to burn fat and fight cancer. Vitamin C is essential for maintaining the integrity of cells and protecting DNA, functions that are critical for both increasing metabolism and preventing disease. A study from the Hong Kong Institute of Vocational Education demonstrated that orange juice, which is rich in vitamin C, helps protect DNA from oxidative damage. In the study, 6 participants consumed 1.75 cups of pasteurized orange juice. Researchers used the COMET test to assess DNA damage caused by hydrogen peroxide, comparing results before and after juice consumption. A placebo group received sugar water and a vitamin C tablet. The results showed that orange juice consumption significantly reduced DNA damage, indicating that whole food sources of vitamin C, not just supplements, offer protective effects due to their synergy with other phytonutrients. Kiwi is another fruit with a high vitamin C content and powerful DNA protective effects. A study conducted in Scotland found that regular consumption of kiwi significantly decreased DNA damage and enhanced DNA repair. Participants who ate kiwi daily showed a 60% reduction in DNA damage and a 66% increase in DNA repair capacity. These findings highlight vitamin C's critical role in cellular defense, neutralizing harmful free radicals and supporting genetic stability, both essential in cancer prevention. Beyond DNA protection, vitamin C plays a vital role in regulating the immune system, which helps prevent disease and supports fat metabolism. Chronic inflammation is a known risk factor for both obesity and cancer. A Japanese study found that women who took high doses of vitamin C had a 74% lower risk of developing active lupus, an autoimmune condition characterized by immune system dysregulation. This suggests that vitamin C not only protects against oxidative stress but also modulates immune responses. In addition, vitamin C promotes the activity of regulatory T cells, which help control excessive immune responses and maintain immune balance. Regular intake of vitamin C-rich foods like oranges and broccoli can help increase the population of these immune-regulating cells, thereby reducing the risk of inflammation-related diseases. Vitamin C is also essential for metabolism and fat burning. It plays a key role in the production of collagen, a structural protein necessary for the integrity of skin, muscles, blood vessels, and connective tissues. Collagen synthesis depends on adequate vitamin C levels, and maintaining healthy collagen supports tissue regeneration, enhances body composition, and can help accelerate fat metabolism. To gain these benefits, vitamin C-rich foods should be incorporated into daily meals. Citrus fruits such as oranges, along with kiwis, strawberries, and vegetables like broccoli, are excellent sources that are easy to include in a balanced diet. These foods support immune health, DNA integrity, and metabolic efficiency, all vital components of disease prevention and healthy aging. If dietary intake falls short, supplementation may be beneficial. Forms like ascorbic acid and sodium ascorbate are known for their high bioavailability. A study published in Nutrients emphasizes the importance of choosing high-quality vitamin C supplements, preferably those tested for purity and effectiveness. Most experts recommend a daily intake of around 500 milligrams, though this can vary depending on individual needs. It's always advisable to consult a healthcare professional for personalized dosage recommendations. 5. Vitamin K2. Among the emerging nutrients in cancer prevention and metabolic health, vitamin K2 has garnered increasing attention from the scientific community. Known scientifically as menaquinone, this compound has been shown to exert potent anti-cancer effects, particularly through its ability to inhibit angiogenesis, the formation of new blood vessels that tumors rely on to grow and spread. Research from Hiroshima University in Japan has demonstrated that vitamin K2 can effectively suppress the growth and vascular development of colon cancer cells. Similarly, a study conducted at the University of Illinois found that vitamin K2 inhibited both proliferation and angiogenesis in prostate cancer cells. These findings suggest that vitamin K2 could disrupt the nutrient supply to tumors, thereby acting as a powerful natural defense against cancer progression. Beyond its anti-tumor properties, vitamin K2 plays a pivotal role in cardiovascular health, a system intricately linked to fat metabolism. A population-based study revealed that individuals who consumed diets rich in vitamin K2 experienced a 52% lower risk of severe atherosclerosis and a 57% reduction in mortality due to heart disease. This is likely due to vitamin K2's ability to inhibit abnormal vascular calcification and suppress cholesterol synthesis, thereby protecting blood vessels from plaque buildup. Vitamin K2 also supports healthy fat metabolism by activating osteocalcin, a hormone that improves insulin sensitivity and promotes energy expenditure. This action encourages fat breakdown rather than storage, making vitamin K2 beneficial in managing weight and reducing the risk of obesity-related disorders. Natural sources of vitamin K2 are found in select animal-based and fermented foods. Dark chicken meat, like thighs and drumsticks, contains high levels of K2, especially when the fat is trimmed. Though often overshadowed by leaner cuts, these parts offer distinct metabolic and anti-cancer advantages. Fermented cheeses such as Gouda, Emmental, and Stilton are also rich in K2. The long-term Epic Heidelberg study, which followed over 23,000 participants for up to 14 years, identified cheese as the leading dietary source of K2. Men who met the recommended intake, equivalent to 1 to 3 slices of cheese daily, were found to have a 35% lower risk of lung cancer and 65% lower risk of prostate cancer. Kimchi, the traditional Korean fermented dish, offers another exceptional source of vitamin K2 thanks to beneficial bacteria involved in fermentation. The World Institute of Kimchi in Korea identified Lactobacillus kimchi, a novel strain that produces vitamin K2. Extracts of kimchi have shown cytotoxic effects against leukemia, liver, colon, and bone cancer cells, underscoring its potential as a functional anti-cancer food. For individuals who may not get enough K2 from diet alone, supplementation is a viable and effective option. -7 Malawian quachas, a long-acting form of vitamin K2, is especially recommended due to its superior bioavailability and prolonged action in the body compared to other forms like -4 Malawian quachas. While exact dosage needs vary, most experts suggest 100 to 200 micrograms of -7 Malawian quachas daily to optimize health outcomes. As always, consulting with a healthcare professional is advised to tailor intake to individual needs. By incorporating vitamin K2, through foods or supplements, into your daily routine, you're supporting not only your body's ability to fight cancer and burn fat, but also enhancing cardiovascular integrity and metabolic balance. Cancer is not a final sentence, it's a wake-up call, urging us to rethink how we live, especially when it comes to what we eat. From vitamin C's ability to protect DNA and strengthen the immune system, to vitamin D's role in immune regulation and fat metabolism, and vitamin K2's power to block blood supply to tumors, all these nutrients show us one clear truth: micronutrients, though small, carry immense power to fight cancer and enhance metabolic health. Cutting-edge scientific research continues to confirm that food is not just fuel, it's medicine. Every time you choose the right foods, you're choosing prevention over treatment. By nourishing your body with essential vitamins, you're not only protecting your cells from damage, but also building a resilient immune system, a healthier metabolism, and a stronger foundation for long-term wellness. If you found this video helpful, don't forget to like it, share it with others, and hit the subscribe button to stay updated on the latest science-backed insights on health, nutrition, and cancer prevention. Your journey to healing and protection starts with you, and it starts today.